on a medium of 24 days. We're finding that ice and crystal are the most commonly used forms. Frequency of use in the last 6 months was 12 days for ice or crystal, 10 days for speed, and 6 days for base. The majority of methamphetamine users reported injecting amphetamines in the last 6 months. That's a concern, I guess, because we do see a lot more harms associated with injecting drugs. So when we're talking about amphetamine users in Australia, we're mainly talking about people aged 20 to 29 years. They're mainly male. Average age of initiation is 18.6 years. And what we're seeing is an increased use of ice, but at the same time a decreased use of base and powder. So overall, the rates have stayed about the same. Those aged 14 years and above in the past past 12 months that had reported using amphetamines, it was 2.1%, and that's the same that we saw in 2010. So those overall rates have not increased, but we're seeing increased use of ice within those numbers. And it's been, I guess what we're starting to also see there is that sometimes using those more potent forms of drugs can result in more harms. So I guess that's why there is a bit of concern out there. And yeah, we're also seeing an increased use in people using at least once per week. So we're seeing an increase in frequency of use as well. Okay. And so when we're talking about harms, this is just a quick list of some of the harms that we can see from amphetamine use. So increased risk of psychotic symptoms, reduced social and occupational functioning, various physical health problems, poor nutrition, drug driving, accidents, overdose, to name a few. And when we start to look at those harms, that's, I guess, why we're very invested in developing treatments that are effective for this population, because it does have quite an impact. So we do